Hello, this is Dr. Luke Bosdet, Clinical Psychologist. This video will cover completing a thought record, a common technique used in CBT. There are several purposes to completing a thought record. The first is to bring awareness to the relationship between your thoughts, feelings and behaviours in order to understand how and why they connect. The second is to consider whether something like depression, anxiety or past trauma is influencing the way that you see a situation. The third is to start to build understanding of yourself and how you react to things across many different situations. And finally, the fourth purpose is to start to get used to stepping back from your internal experiences, rather than getting caught up in them, to build more control in how you respond. Usually, thought records are best completed for events that cause strong emotions. The large majority of people will only complete records for negative emotions rather than positive, as these tend to be more problematic. It is best to complete a thought record as soon as you can after a situation, or at least on the same day. Otherwise it can be difficult to remember the specifics of what you thought and felt. There are different types of thought records, but I'm going to cover the basic format that appears in all thought records: the triggering situation, the associated emotion, and negative automatic thoughts. Other versions might include another column for identifying specific thinking errors, developing alternative thoughts, or plans for action. Other videos will cover working with automatic thoughts or the difficult emotions that arise. First of all, you put the time and date of the situation you want to record in the thought record. In the situation column, you put the who, what, where, and how. It is best to be specific and factual as possible. Remember that triggering situations can be external, such as someone making a comment, or internal, like an intrusive thought or memory. Triggers for negative emotions can also be before, during, or after a situation. Make sure you're focusing on the right part of the situation that's caused the negative emotion. An example of an external situation might be Friday, about 3 p.m. A friend mentioned about going to a party that I wasn't invited to. An example of an internal trigger might be Sunday evening. A memory being bullied as a teenager comes to mind. The second thing to record is the emotions associated with the situation. It can be helpful to use an emotions wheel if you struggle to put a name to a feeling. Be careful to not mix up thoughts and feelings. Feelings tend to be one word, like anger, sadness, disgust, while thoughts are more elaborate meanings of a situation. It's also helpful to rate the intensity of the emotion from 1 to 10. For example, when my friend made the comment about the party, I felt sad and hurt, both rated a 7 out of 10 in intensity. When the memory being bullied came back, I felt anxious, rated an 8 out of 10 in intensity. Automatic thoughts are the constant stream of fast and spontaneous thoughts that cross our minds, usually in the form of words or images. Because they're so rapid, they tend not to be as rational or careful as when we deliberately think about something. In this section, write down the thoughts that went through your mind at the time in the same form that they appeared. Then rate how much you believed them in the moment from 0 to 100%. Your automatic thoughts will link logically with the emotion. For example, when my friend made the comment about the party and I felt sad and hurt, my automatic thoughts were, they don't like me, and I wasn't invited because I'm boring. Rated 95% and 80% respectively. For the memory of bullying and feeling of anxiety, my automatic thoughts were, I will be bullied again, and I can't stop this from happening. Rated at 90% each. You are likely to have multiple automatic thoughts, but usually there are 1 or 2 thoughts that affect you the most. If you still find them distressing now, or they're likely to occur again, then you may want to work further on these thoughts, either by bringing them to therapy or evaluating them yourself. There'll be another video added for working on thoughts. So that is all for completing the basic thought record. If you have any questions or queries, please leave a comment below. If you're one of my clients, then you can either contact me directly or wait until the next time we meet. Thank you very much.